Okay, I will call the meeting to order, the April 8th Select Board meeting to order. I will read the script for remotely conducted open meetings. As a preliminary matter, Chair Don Holgate, permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Rita Higgins?
Yes.
Christy Ferrantella?
Yes.
Is there a weird echo?
Here.
Preliminary matter, Chair Don Holgate, permit me to confirm that all...
Everybody has to mute their lines if they're not speaking.
Jason Bridges?
Here.
Matt Fee?
Here.
And staff members, when I call your name, please respond in the affirmative. We have Town Manager Libby Gibson.
Everybody
Present.
has to mute their lines if they're not speaking.
Assistant Town Manager Greg Tivnan.
Present.
Assistant Town Manager Rachel Day.
Present.
Finance Director Brian Turbett.
Present.
Director of Culture and Tourism Janet Schulte.
Here.
Health and Human Services Director Roberto Santamaria. Oh, I didn't hear you. Are you muted?
Present.
Thank you. Chief of Police William Pittman.
Present.
Operations Administrator Erica Mooney.
Present.
Human Services Director Taylor Hilst.
Present.
And Housing Specialist Tucker Holland.
Present.
And then also as anticipated speakers on the agenda, we have Dr. Diane Pearl and CEO of the hospital, Gary Shaw.
And we're here.
We're here.
And I don't think I missed anybody. Good evening. The open meeting of the Nantucket Select Board is being conducted remotely, consistent with Governor Baker's executive order of March 12, 2020, due to the current state of emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend public gatherings, and as such, the governor's order suspends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted with agenda materials for this meeting, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will feature public comment via YouTube. For this meeting, the Nantucket Select Board is convening by video conference via Zoom app as posted on the town's website, identifying how the public may join. For Zoom meetings, please note that this meeting is being recorded and that all attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to share your screen. Anything you broadcast may be captured by the recording. Meeting materials. All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda. Meeting business ground rules. We are now turning to the first item on the agenda, but before we do so, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comment, questions, or motions. Please hold until your name is called. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage in a conversation with other members, please do so through the chair, taking care to identify yourself. For items with public comments, after members have spoken, the chair will afford public comment as follows. Staff will activate the chat feature on YouTube. Members of the public who have comments or questions can use this feature to communicate with the public body. Instructions are on the town's website. The chair and/or staff will do their best to address the questions and comments either during the meeting or subsequent to the meeting. Finally, each vote taken at this meeting will be conducted by roll call vote. Okay. I will turn it over. I don't believe that there are any changes to the agenda. We'll accept it as written, and I will turn it over to the town manager for announcements and to go through the COVID-19 weekly updates.
Thank you. Just one quick thing. Did we add that new business item for the tax bills?
Oh, yes, I'm sorry. There is an item that has been added to extend the date when tax bills are due. We will take that under the new business portion.
Okay. Me? No. Okay. Can you hear me?
Yes, I can hear you.
I can't get used to this. Okay, so with regard to the local emergency order status, we've got a number of emergency orders, as we all know, that are out there, and some have changed, and they do get a bit confusing. Even we get a little bit confused by them. So right at this point, we've got emergency order number 1, which is a temporary moratorium on construction. That has been replaced with Board of Health supplemental order number 1, which was amended on April 2nd. And as a result of that, I won't go over all of that because I think you all talked about that last week, and you know what the Board of Health action was on April 2nd. And it's all been posted online. Waiver requests are still coming in. The waiver request process is if you believe you have an emergency work to be done, that would be a waiver from from non-essential services, or some business that you have to take care of. You can submit a building waiver to the building commissioner, a public works like waiver to the director of public works, an environmental type of waiver to the natural resources director. They review it and make a recommendation to the EOC group, and then it's discussed in here. Sometimes it's research, sometimes more information is needed, and ultimately a decision is made whether or not to grant the waiver, and we are now posting the approved waivers on the town website. We are in the process of working on what we're calling, I guess, back to work plans for construction, landscaping, and restaurants. We've got staff in plus with some people from, I believe, the Nantucket Builders Association, and I think you, Dawn, as chair, are working with them, or will be, to get a back to work plan in place. Natural Resources is working with landscapers on that back to work plan, and restaurants will be culture and tourism, licensing and health. And also with regard to landscaping, I think that Jason and maybe Matt are involved in that. And those plans will need to be accompanied by safety rules at job sites and enforcement plans, so we can ensure that those safety rules are being enforced because of the situation that we're in, trying to stop the spread of COVID-19. We are hoping that at your meeting next Wednesday, the 15th, we will have some plans for you to review and discuss, and perhaps hopefully make recommendations to the Board of Health, which is meeting the next day, April 16th. And hopefully there could be some adoption of one or more of these plans, or requests for additional information or more input or whatever, so that we can continue to work on them and get them in place as soon as possible. There are a couple of issues that have come up that we need to perhaps have some internal discussion about, or talk to you all about it, not tonight, but housing, for example, for some of these workers that are going to be coming back to the island to work in any of those industries, and how they're housed and what safety measures are going to be put in place for that housing is critical. We don't want to go backwards. We want to go forwards with the stopping of the spread. So part of this whole thing relates to when can we get these plans activated and in place and work going. So I think we're kind of relying a bit or a lot on the hospital to sort of tell us when we might potentially be in the clear and when we can start thinking about or actually relaxing or lifting any of these orders. So we'll get to the hospital in a moment because I think there might be some discussion about that with their report. In other news at the EOC, we're working on guidelines to allow house moves to continue or to resume. These wouldn't be house moves that involve setting up any of the houses, but at least getting them delivered to the site. We know there's a backup of them at this point, and there's a lot of people depending on the housing to come online. Just a bit of a clarification that the chair and I spoke about this morning. Yesterday, the town website was updated at my direction to indicate that the construction and landscaping moratorium extends until May 4th. That was an oversight on my part. Rather than a date, it should have read until lifted. That's what the Board of Health and the Select Board were expecting. So I'm sorry about that. It became a bit confusing because of the state stay-at-home order. Basically, it's extending a lot of things until May 4th, which is another issue with our local stay-at-home order. And it technically expired on April 6th. So I think our thinking, and I think you're thinking, but I'm not really sure, is that the local stay-at-home order should be extended, but it technically is a Board of Health order at this point. So what we were doing here today, or trying to get to, is some revisions to the stay-at-home order that would reflect some things we've been talking about for your review at your meeting next week, which would include an extended date and perhaps some other things that would be allowed now that weren't allowed then, like perhaps the house move issue could be incorporated into that. And there's some other minor things like that. There's been a bit of discussion here today and over the last couple of days about things like moorings, boat repairs, caretaking, and property management. And people are wanting to do all of those things. And technically, almost all of those things are really not permitted in our orders. But if you read our orders very carefully, things like boat repairs are allowed for commercial vessels only, but it is allowed for that limited purpose. Our order doesn't really allow recreational boat repairs, but perhaps that is something to think about. The issue for us is that maybe not so much the repairs, but the getting the boats into the water before we're ready could be a problem. People are probably going to start coming up this way from other areas of the country pretty soon, and we don't want to get too many people involved in boats too quickly, all gathered together. In other states, they've banned recreational boating for that exact reason. So that's something to just, maybe we can look at that in the coming couple of weeks. Caretaking and property management have been a bit of an issue. They're kind of the same thing, and we've been really trying to stick to what is an essential service and why you need to travel around outside of the stay-at-home ban, the stay-at-home order, and that is for essential services specifically. So what we were going by is going to if you're a caretaker and you're going to a house. You probably can go there and check your house. The chief probably kill me for saying this, but it's not really an essential travel purpose. So potentially, if you think there's something going on at the house that needs your attention, because otherwise a safety or public health problem would occur, then that's one thing. We definitely don't want people going to houses doing construction work in unoccupied homes that really isn't urgent or an emergency. But we have been discussing this situation in here today and the last few days. So that might be something we could also take a look at in the stay-at-home order for next week. But again, our whole point in here has been to stop the spread, like we've been talking about. Nantucket's numbers are, I think the hospital can sort of corroborate this, on the lower end compared to other towns and other areas. And we think that is attributable to the very strict social distancing and measures that we've put into place here. And we definitely don't want to go backwards. So we're just trying to really make sure that, again, short-term pain, long-term gain. We know it's very painful right now for people. It's no getting around it. And we want to get people back to work as quickly as possible, doing whatever their work is, but we also don't want to jeopardize how far we've come. So those are the issues that we've been working on since last week.
Do board members want to make any comments or questions, or do you want to kind of run through the whole thing and then have some discussion?
Either way with me, as long as we get if we're going to talk about this at the end, or if we're going to talk about it now at the end of this section, that's fine.
Maybe we should hear all of the reports and then have some discussion.
Sorry, did you do the action item for emergency order number 4, or is that what you're talking about doing later?
Looking at my outline, I wasn't going on the agenda. That is basically next.
Okay.
So emergency order number 4, that's just the technical name of it, but it really just extends the recreational shellfish licenses, which requires a vote of the select board. I think there was a memo in the packet.
I guess we would take a vote on that now, or we can have discussion on it. Does anybody have any questions or concerns with that?
I don't.
Matt?
So moved. I make a motion if there's no discussion.
Everybody good with that? Is there a second?
Second for discussion.
Okay. Did you want to?
Yeah, just a quick question of what's the thinking behind it, just so the public knows why we're doing it.
Sure.
Jason, the shellfish licenses for recreational shellfish, this doesn't apply to commercial, expired on March 31st. Now, ordinarily, we have a permit window open where people can come in and purchase a permit for this year, but because we've been closed, they haven't been able to do that. So this order will allow the existing licensees to continue to shellfish until we can get the window open and start selling 2020 permits.
Thank you.
Okay. Is there any further discussion? I'll do a roll call vote. Jason Bridges.
Aye.
Christy Ferrantella.
Aye.
Matt Fee.
Aye.
Rita Higgins.
Aye.
John Holgate, aye. And then we can move on to the next item.
Okay, so the next item, state emergency order status. I don't know that there's too much new on that. Guidance comes out of the state all the time, and there are press conferences almost daily out of the governor's office. There are conference calls multiple times a week, and it's really hard to just sit here and sort through what applies to us, what doesn't really apply to us, but there's a lot of things we're trying to pay attention to. One thing to make note of, I don't want to sound like a broken record, but we all were agreeing in here today that at every press conference that the governor is doing, he's getting more and more emphatic about stay at home. He started out saying, everybody really just need to stay at home. And it's progressing to you must stay at home. You have to stay at home. You absolutely positively should be staying at home in very strong ways. So it's coming out of him pretty constantly. I think the next item would be to go to the hospital and ask and just get a report from you all. And maybe report out on the issue of when do you think we might be able to return to work?
Thanks, Libby. I have Dr. Pearl here with me, and I'm glad she can join this evening and add some context to what we will talk about tonight. I know most of you haven't been in the hospital during this particular ordeal, and I hope you do. If you need to come here, know that this hospital is for you, and we are open, although we do screening coming in. This is your community, it's your hospital, and we're here to take care of you. So on that note, if you were to come by my office administration, you would see a yellow sticky on my door that basically says number 19. And I've been waiting and waiting and waiting for people to ask what that 19 represents. And the day before it was 18, the day before it was 17. Well, 29 days ago, when we were looking at the outbreak of coronavirus, COVID-19 around the world, and we started to see index cases in different communities across America, I sat down with my team, which we had already drawn together in early January, to look at and create an incident command focus on how do we prepare for what we felt might be a very real possibility that arrives. The sticker that I had on my door 29 days ago, or a little before that, was a countdown, and it started at 10. And the goal of this was to know that if you look at the disease and how it spreads and what the incubation time is, when we started to see it show up in areas where we had a high transition of disease around populations, I picked a number where I felt the incubation time was going to start affecting us. And so we started counting down from 10 to go to 0. And that represented when we would get our first index case or positive COVID test. We got to day 9 out of 10, and we had our first COVID. So I'd say that we very accurately, not guessing, have been able to look at the simple math that's around COVID and how long it takes to show up once it's circulating in a population. So the significance of the 19 now is that it's been approximately 19 days since COVID arrived. And when you look at, again, the epidemiology that's in this country, if you have one index case and 0 social distancing and 0 impact to physical distancing, and we behave as the population does, within 30 days, that one person understanding a multiplication factor of the disease spread, which is 2.5 every 72 hours, in 30 days, you would have 400 people from that one infected. Now, if we do the math again and we start to replicate that with all of those people infected, they have their incubation time of from up to 14 days. You have the potential to have thousands and thousands of people on this island infected, and that's with doing no social distancing. So we're at day 19, and what we've been able to accomplish through the town's support and through focus and planning in this hospital is a relatively low ratio of COVID being found in the population. We have done our drive-ins, almost the first in the Massachusetts to implement a drive-through, where we've found 10 cases that are positive, and we've then traced those back to homes, families, individuals, and their contacts. And so there are multiples of people at home now that have been progressing through either clinically positive disease or suspected disease, and they are in our community and they are recovering. Although this last Sunday, we unfortunately experienced our first death related to COVID-19 here at the hospital. And no one wants that. And no one wants any more of that. But to ensure that we do our best to protect this community against this spread that is a killer, we must continue to go through the next 11 days until we hit that 30-day curve to actually see what this one index case has contributed to what could be a very large spread of COVID-19 in this community. Now, I get emails and I get texts and I get phone calls like the rest of them. When can I come home? When can I come out of my home? What does an all clear look like? Well, I can tell you that right now you are not in the clear at all. And you won't be until we can look at this spread over the next 10 to 11 days to see how well the effect of social distancing has helped us. And it is not sexy and it's not fun to be told I should stay home, I should avoid people from 6 feet, I'm not playing with my grandkids, I'm not going to the grocery store and enjoying coffee cups with people. You're doing all the right things, and I couldn't commend you more. But if we were to go backwards now and relax the standards that we have in place, we run a significant risk of COVID reappearing. And that's because the metro areas that surround this island on the coast have not yet reached their peak. How you can start to understand when it's time to start graduating into the all clear is when the peak has climbed to a point in these metro areas, and 2 weeks after, you start to see a death rate follow. When we can start to believe that there is a sustainable gain against COVID in the metro areas, and hence not transferable to large degrees to us, is when those deaths start to drop very, very rapidly after a spike. And that's typically 2 weeks, within 2 weeks after you have your major spike, which we've not seen in Boston, and we're still not seeing in New York, and we're not seeing it on the Cape. But we have done extremely good work here. You've social distanced well. There are many apps out now that look at tracking movement within the United States. And if you look across the United States, a good majority of the areas are showing a D or a C or a B, and you're showing an A or an A+ on this island because you're staying put and you're doing the things that help you stay healthy and your family stay healthy. So what does the all clear look like? Well, there's a very good Apple podcast that we put on our website by Dr. Fossey. It was done yesterday, that describes what an all clear could look like from a country perspective or a region's perspective. But in summarizing some of his statements, to make sure that you don't enter into a free-for-all for COVID-19, and you have the opportunity to migrate into things with a progressive, measured approach. This is not a lights off, shut it down, and then lights back on, turn them on scenario without knowing what your towns around you are doing related to the COVID spike and the death rate. So we've not seen that yet. But what we do know is that there's light at the end of this tunnel. We're seeing it here now. We're seeing that in probably 2 to 3 weeks, we could do measured things, which would look like going to a beach, but distancing from 6 feet from one another. It could be going into a restaurant that has 50 tables, but the restaurant would voluntarily only allow 10 to be populated. It could mean going and taking walks, but staying 6 feet apart. It would mean no handshaking. It would mean a lot of social norms that we would expect, even in the construction industry where they share tools and share vehicles, that we would have to have strict understanding of how we would approach those industries. Or we run the risk of the uninfected still receiving COVID, and then it takes off again, and we're right back where we are. So there is a measured distance that we have to go to put things in perspective so you don't lose the gains of all of this pain that we have all taken. And so with that said, we are seeing, I'm going to just give you a little bit of information as soon as I get my phone alive here. Through our testing area, we've had 180 tests that we've done to date. We've only had 10, as I've mentioned, that were positive. We've had 164 negative, and we have 6 pending, which is showing that there is a large increase in capability to give us quicker turnaround times. And that's very important when we look at moving into the all clear, and that before we can even get to think about an all clear, we must have testing or screening in place that is efficient and accurate. And we must have antibody testing that's available, which it is not right now commercially. According to Dr. Fossey, it should be available in the next few weeks. And that then would show the doctors and the clinicians through antibodies who's been infected and who's recovered. And the screening would show who's newly tested and who's shedding the disease. With those 2 tools in the medical facilities bucket, we can start to predict and look at what the spread of COVID looks like in our community. We've had a lot of tests, questions about the drive-through and can you come here, and do we have quite a bit of testing? And the answer is It is not widely available. We started out screening with CDC criteria, which we still use, and we've been able to work through what's appropriate through Dr. Pearl's recommendations on allowing screening to occur based on specific clinical reason or needs or recommendations. And so she can speak to that in just one moment. But we are still testing typically when you come in, if you have symptoms, then we would do a swab. We've seen a decrease in the number of people coming. And over the last few days, we've seen from 8 to 5 to 4. And today we had 1 drive-through our screening area. That is 100% the work of what you're doing right now by supporting these orders of shelter in place. It is because of what you've put in place. Our specimens are going out and they're coming back, and we're able to tell patients almost right away within 24 hours that their results are either positive or negative. We have been able to receive a limited testing stock of an analyzer that we have in the hospital named Cepheid. And the Cepheid Analyzer is a disk process testing that gives us a 45-minute turnaround. But because there's such high demand in the United States, we have only been able to get a limited number of tests, and currently it's 20 that would be able to use from the disks that we have, and 20 is no test for a major mass test of a population of 17 or more thousand. But it is a test we can use for our medical personnel if we want to return them to work, if we have a suspicion. It is for our first responders in the community. If they have a need to be a fireman or a policeman or a soldier, we can take care of those, and we should see those increase over time, but not any more than 60 a month for the next several foreseeable months. So when we talk about the work you've done, I commend all of you for hanging in there and staying in there. But we're not anywhere out of this right now. You may feel that the bands of the hurricane have come past us. We've seen some cases and we've seen a death. And we're in a little bit of the eye of the hurricane. But the next side, the next 10 days is really the defining period as to what it will look like with the work that we've done. And I believe it's going to be positive. I believe it's going to be good, but it has to coincide with the decline in the death rate on the coast, or we'll end up with that disease transitioning back to us if you lift off too quickly. But I do think it's appropriate to start thinking about what does an all clear look like, and what is, a reentry in different industries look like. So with that, I'll be quiet, and I know Dr. Pearl has some comments.
I don't have much to add to what Gary, all that information Gary gave you. But I have been so gratified to see how seriously everyone on Nantucket is taking your recommendations and your orders to stay at home, because it is rare to see people out and about. It is extremely rare to see anybody without a mask at any place on the island. And those types of behaviors have been adopted by Nantucketers to an amazing degree. And we haven't, and as a result of that, this disease, I think, on Nantucket is not spreading, obviously, like wildfire. The fact is that at least 25% of people carrying this virus have no symptoms whatsoever. And for that reason, people have to maintain social distancing. People who have the virus and are shedding it have no idea they're doing so. And that is unlike so many diseases that we treat and follow. So I can only reiterate what Gary is saying. The science is growing as to how long this will take to remain in social distancing and all these other changes. And the science has changed in 4 weeks since we even were aware of this disease. I can only imagine in 4 more weeks we will have an enormous number of testing availability compared to what we have now, and the antibody testing. And I think strategies for how to control the population in some way that is being worked on in other places. So there is enormous hope, and the light is at the end of the tunnel. How many more weeks is that? We don't know, of course, but as long as it's working for the moment, we're very, very happy. I can only be concerned that when we start to have people come back to the island who are not as successfully isolated as we have been, of course, they will be bringing it back with them. And that's just the challenge we're going to have to face, is there a possibility for testing when people come back, or continuing with isolation in some way so that this doesn't, all of our efforts have not been lost. lots of things to think about how we reopen.
To put a little bit in perspective, Roberto, did you have a stat from Barnstable? We've been trying to monitor other counties' infection rates.
Yes. So what we have so far is here on Nantucket, and I'm going to use the census numbers to make it an easier comparison. To put the statistics specifically, we have 10 cases here and approximately 12,000 people in the population. That's 0.08% of our population was infected. In comparison to Barnstable, there are 423 people infected and 214,000 people in Barnstable County. That is 0.198%, which means that they have more than double our infection rate. And when you look at the Unicast websites, unacast.com, Unicast has us set up as an A in social distancing. We are one of the best in the state, and Barnstable's is as B. And in my conversations with my colleagues out there, the Cape and the Islands Health Agents Coalition, they were explicit in saying that had they put in more strict information, they would have probably gotten ahead of it like we did. And by us getting ahead of it has really helped. It's really important to understand that for people watching at home, that these are matters of life and death. And we see it. We're seeing it already. Barnstable County has more than twice the viral load than we do. That's it.
Mm-hmm. I don't know if there's any questions for the hospital.
No. Rita?
No questions per se, but I just want to say I really appreciate having some sort of milestones or indicators other than just dates that I think we can all be looking for to try and understand when we could consider a phased back to work. So I think that's really helpful, and the more clarity we have on if there's any additional milestones or where we're at with those, I think that will, again, that'll be really helpful going forward.
Yeah, this is Gary, and I would just say that your milestone you're looking at now is April 30th, and that would be the peak of the 30-day infection rate from your index case. That would be, if you did nothing, you'd have, that person would have infected 400 people. And what I can tell you right now is that that data suggests that we're not going to see that level of infectivity. In fact, it doesn't even show that we would get to the 50th percentile. It doesn't show that we would hit the 75th percentile. We are probably better than the 80th percentile in the data that I've been reading because of the work you've all done. If you had not done this work, we would be overwhelmed right now with the number of cases coming in from that index case 19 days ago. And we're not seeing it thanks to you.
Gary, I have a little question, not to rush anything, but what was that you said at the beginning about 10 to 11 days? What could be done then?
In 11 days, the number that's on my door is 19. And that's the date that we had our first index case. And you count 30 days forward from that to show your full infectivity rate of one case creating 400. So that's 30 days. 30 days is the 30th of April. And that pretty much coincides with what the cities are thinking their date for a climate of decline is. And that's because we're so mobile and social. We mirror that, but we are doing much, much, much better than the rest of the country.
Just for clarity, I mean, wouldn't 11 days from now be April 18th?
Or what is today? Today is the 8th. So 30, I'm sorry, you're correct.
Yeah, I know people are going to be confused by that.
Oh, no. Let's look at your calendar and count 11 days from today. And that would be the date that you would have your full 30 days.
Okay.
And that would be for the start of the outbreak, correct? The start of the surge, or is that?
Peak. That would be from the first day, multiplied every day, and it starts climbing, and then people get sick, and they come in within about 5 to 9 days during that first period of time, and then it goes up from there, and you're trying to catch it at that point and control it, and it's almost impossible.
So we have 10 known cases. And these 10 people don't know each other from what we can tell. And each one has a history of travel, whether they went to Boston or to the Caribbean or to Florida or to other countries. And in one of my thoughts about this is that each one of these 10 have not spread it to 300 or 400 Nantucketers, obviously, or we would know that. And so when they got their diagnosis, or even before, they were being socially isolated. And we know that to be true by talking to them. And they each probably have family members who they did infect, but have not been tested. But beyond that, it has not spread into the community, which it would have had they been going to the grocery store, had they been going to restaurants, and no one in the world was aware that this was going on. So we certainly have more than 10 cases on Nantucket. And the last one was probably several days ago, or maybe a week ago. That person can spread this disease for 2 or 3 weeks. We found by doing some research and retesting that you can shed the virus for a very long time. Then that next person has a 14-day quarantine period during which they might have symptoms. So there are weeks and weeks before we can say that the community is clear. And at the same time, we're going to have to be bringing people into our isolated community. It's a natural way that this island works. So it's going to just take some thinking of how to do that in a stepwise fashion while we're still watching sort of rates of a disease occurrence.
And just for clarity on my comments about dates, 11 days, I believe, would be the 19th. But I know the governor and the mayors of the cities have indicated that they feel their curve is going to be peaking at the 30th in the communities on the coast. Ours is sooner because we got a hold of it quicker. But if we don't follow the peak on the coast, that's when we run the risk of it coming back.
Matt, you had your hand up.
I guess just a quick question. Does the clock start again? If we get, if we feel like we're pretty clear, but all of a sudden we pick up 2 or 3 more cases, does the clock start all over again?
That's the risk, and that's the possibility. And that's why if you do a re-entry, you have to follow social distancing. What we've learned now is a better norm moving forward until this disease either is controlled through a vaccine or medicines or antibodies. If we learn that once you've had it, you won't regain it again. And that's the time that we're trying to gain here. So yes, that's the real risk we're trying to help us get away from.
And I think we're running a bit of a risk, like you said, with no matter what at this stage in the calendar of Nantucket, people are going to start returning. And we've got to have some systems in place to allow things to function in some new form that addresses that influx of people. So I think that's what we're working on. Christy?
Just to follow up a comment about people coming here, I think it is really smart of the town to start thinking about there are going to be summer residents or even, year-round residents who typically go down to Florida for the winter who might be migrating back up this way, and making sure that we do have a structure of how we have public education and outreach. So ways to prevent them from going to the store, making sure that they know about the different resources, figuring out if there's a way to start a food delivery service, and Stop and Shop doesn't have the capability to do it. Just ways of getting the information out to these people if they do start coming this way.
following up on what Christy said, is that if we were doing that, would the hospital be advising a 14-day quarantine for everyone that came, or what types of things should we be thinking about?
Well, I believe the state has asked for a 14-day quarantine. I don't know the period that they've indicated that should last. I'd have to go read that again. Those are the things we need to think about collectively on if they're coming from a hotspot area or in this country where we have a focus. I think we'd have to consider those types of requests to ensure that we wouldn't start another spread.
Jason?
Madam Chair, is this where you want to talk about, my opinions on back to work and that kind of stuff during the hospital, or did you want to wait to the end of all these?
If you want to say something now, or we can keep going down the list and talk about it all at the end of this section.
Okay, I can wait.
And then we'll be taking public comments as well. So is it public outreach next? Oh, Christy, sorry.
That's okay. I just wanted to make sure, will the hospital be staying on for when we discuss the back to work orders?
Yes, we plan on being here.
Okay, thank you.
So public outreach is something that we're working on pretty constantly. Greg, you got a little update on that?
Hi, good evening. My hat's at the EOC, so I had to hand make my Stop the Spread, show solidarity. So Florencia Rulo and I are remain the outreach component of the incident response team, and we're trying to receive, disseminate all this complex information that you even hear tonight as efficiently and accurately as we can. Our primary tool still remains the website. If there's anybody out there, the board finds a different method for us to communicate, as Christy was just saying, how do we reach others? We use all different social media, and we try to replicate our information in many different ways, so we keep getting the messages out there. We're in daily contact with the hospital's PIO, Jason Graziade, who's been amazing. And we're in daily contact with Noah Carberg from the PIO, from the airport, to get updated information. We do want to stress that if you have questions regarding hospital activity, go to the hospital's website. Go to the Nantucket Cottage Hospital. Their COVID page is amazing, very well updated. And we seek to try to push people that way to get the most accurate information. So last week was a little calmer than the previous couple of weeks. We did entertain, media requests from 4 different outlets that range from the Globe to the Inky to NPR. And we had several messages that we pushed out through press releases, 2 additional press releases, as well as multiple targeted blasts from our website. Like I said, the website remains our number one tool, and just to kind of put it in perspective that this time from the periods of March 8th to April 4th last year to the same period this year, our website had only 38,704 hits last year. This time, the same time this year, we had 175,196. And through the statistics page, the majority are going directly to the coronavirus updates. So we stress that it's really important that we keep that information fresh and accurate. And with the help of the town manager this week and Florencia Rulo, we did an overhaul of the website, so just to make the information a little more accessible. So that's pretty much it in a nutshell. We continue to field calls from the press and from the public and try to get the information out there as accurately as possible. That's about it, Libby.
Thank you. Janet, Economic Impact Work Group.
Hi, good evening. A survey of the economic impact of the COVID-19 virus across all of the island's economic sectors was sent to 1,500 email addresses last Friday. To date, we've had a 20% response rate and have done additional social media and traditional press releases to get the word out to get more people to respond. We've extended the deadline to April 15th from this Friday in order to reach our goal of a 30% response rate. This will show us gradations in how different sectors are being impacted. We know everybody's hurting, but we don't know who's hurting more than others, and this information will help us get there. That data can be used for lobbying and advocacy efforts and to help inform local decision making. Libby mentioned in her comments at the start about several efforts that are underway to help different sectors return to work or to make plans to return to work when the emergency ban is lifted. And that information is going to be helpful once those plans are available for other sectors, like cultural organizations need to know what social distancing rules are going to be. And they're eager to find that out so they can plan how they're going to welcome, if they can welcome visitors into their museums, galleries, aquaria, whatever. So that's what we've been up to this week. I will call together a meeting of the Economic Impact Task Force when that data comes back and we have an analysis from the consulting group to share with the task force members. I think Taylor was going to update next too on what she's been up to.
Go ahead, Taylor.
Hi, thank you. Good evening. So I do want to start with talking about a new program that we've rolled out, Senior Meal Delivery. It's a Town of Nantucket program we started on March 23rd. It is not the same as Meals on Wheels. That functions entirely as normal and does an amazing job. This is to augment that. So it's a partnership between the Saltmarsh Center and Sandbar or the Whale. They've been very generous with their time and efforts. To date, as of this evening, we have delivered 738 meals since we began on March 23rd. We originally were going to end this program on April 10th, but we have plans to extend it with an end date to be determined, not yet unknown. We now, very excitingly, have a new funding vehicle through the Community Foundation for this, and that is what is enabling us to extend. And the most exciting part about it is they are doing an expansion based on our model via the Community Foundation's Nantucket Fund for Emergency Relief Food Initiative. So essentially, it's going to follow the same model that Saltmarsh is doing with Sandbar or the Whale, and we're going to partner human service agencies with restaurants. So it benefits everybody, essentially fund restaurants with grant money to provide free meals to those in need. So that's really a win-win and a very creative way to meet a lot of people's needs. So we're really excited to be any part of that and to be the model that it's being based on. In addition to that, and this will also roll out continuously as new restaurants and new agencies get on board and partner. In addition to that, through the Contract Review Committee, Town of Nantucket provides funding to 11 human services agencies. And we have worked to, instead of continuing to provide that funding quarterly for the rest of the fiscal year, to release the rest of their funding for FY20 to provide them with greater flexibility to meet their needs during this time when obviously there's an expected increased demand. So that's really exciting that we were able to do that. Another thing that we've worked on is exempt emergency daycare. So Governor Baker placed an exemption for emergency childcare programs authorized as basically to provide a place for essential services workers, children to go, basically healthcare, public health, first responders, and ensure that they're able to be at work to work on the COVID response. We now have 3 local providers licensed for EEC. So that's wonderful. Greg talked about the website being our main place that we're getting this information out there. I would encourage everybody to look at the Assistance for Residents pages. It goes over everything that I'm talking about. There's a great new section on food specific relief, and it also touches on all of the traditional forms of assistance that Nantucket residents have access to. So this includes Nantucket food, fuel, and rental assistance, which includes the food pantry. It includes the WIC program, Special Supplemental Nutrition Program for women, infants, and children. They in particular have reached out and talked about how they're kind of braced for an increase in demand, but they have not seen that from Nantucket. And it includes SNAP and transitional aid to families with dependent children. So all resources that we have access to, and it provides a very kind of user-friendly phone numbers that work and how to apply online, and local agencies that can assist with the application process as well. So I would encourage everybody to go look at that. It's laid out in an extremely user-friendly format.
Thank you, Taylor.
Thank you.
Okay, so moving along in the report, town services status. So the town offices remain closed through May 4th, as I think we know. Essential services are in place only right now. We do have some people working remotely still, and we're trying to add some more. We changed our daily call with the emergency response team to a twice weekly call, plus we have a department weekly call on Mondays. We have a daily communication that goes out to employees, and we're trying to mix that up a little. It's been in a video by the HR director, and we're trying to expand it a bit to get messages out there from department heads. Maybe one of the board members would want to do a message, maybe an employee, things like that. We're trying to just mix it up and make it a little more interesting, even though Amanda is, of course, fascinating. The board gets a daily situation report. And budget and staffing, we are starting to look very closely at the budget for more so for fiscal 21. Fiscal 20, we're not out of the woods, I don't think, with fiscal 20, pending what comes in more towards the end of the year and the fourth quarter, fourth quarter. But I think in our discussions with Brian, we probably don't need to make any budget adjustments to fiscal 20. However, fiscal 21 could be a different story. We, as I think I've mentioned to you all, we're working on some different approaches and assumptions for what revenue decreases we would want to perhaps be projecting. We have meetings lined up next week with the Capital Program Committee and the Finance Committee to review that with them, get their input so that we can then use that to develop recommendations for you all, hopefully at your April 22nd meeting. So that's taking some time to work on it. Thank you, Brian, and Rachel and Greg and Amanda. They've been really helpful in that. I think that might be it for the EOC Town Administration update on COVID-19 for now.
Thank you. Do board members want to make some comments or questions at this stage, and then we'll open it for public comments? And Jason, can you do the public comments again? I'll call on you right now since you're raising your hand.
Sure. I'm going to charge you though. I got a bunch of things. First off, I want to say to Libby and all the EOC, thank you for the daily situation reports. Really, really helpful. I know it probably takes a long time to get those going, but it really helps me answer questions to all the constituents and everybody in the public who's asking me. Roberto, I want to give thanks to you and your staff working with Stop and Shop. That's one of the main questions that I get is, why can't we just tell Stop and Shop to do this and do this? And that email that John hadn't sent out was really informational. But that's one question I have is I don't really know how to respond to the public when they say, why can't we just have Stop and Shop do X, Y, Z? They don't really understand that, and I need some help explaining that.
So one of the big things about Stop and Shop, sorry, Gary, I have to take the hat off a little bit. It's burning me. One of the issues with Stop and Shop is it's not always just that simple. We can't always just say this is what has to happen, unfortunately. And there's good reasons behind it. One, as far as the masks go, I'm trying to explain it as simply as I can. As far as things like masks and gloves go, a lot of times they tell us, why can't you just tell Stop and Shop to wear masks and gloves because they're a food establishment? Well, technically they're not. They're a retail grocery store. The food establishments as part of them are the bakery, the deli, the meat cutting, things like that. They always wear gloves. They always have to wear hats, and now they're wearing masks. As far as employees go, the company has to tell them. They have to set a corporate policy to do so, which I know right now it's still pretty voluntary. If we were to say, everyone, we're going to force you to wear masks, we're going to force you to wear gloves in public, that's actually a civil liberties issue. The Constitution prevents us from forcing people to do that. And it is tough. It is tough. But if they have a lot of questions that you can't necessarily answer, please get them to us so that we can answer them. If we don't hear them here in the EOC, we can't answer them. And then it gets to social media, it starts festering, and it turns into that we don't have the town's best interests in mind. And that is not true. We're here just like everyone else. Don't let it fester. Please come to the source. We're doing our best to get information out to everyone. We're doing our best to get the right information into the proper hands. Please reach out. It is a really important aspect of it.
Thank you, Roberto. I've been getting these questions for 2 weeks, and I tell everybody to call the hotline and do everything. So it is helpful, and I think Stop and Shop's taking really great measures. I know the Lieutenant Governor came out and said, I don't know when that's going to go into effect, but 40% capacity in grocery stores at some point. I don't know if that's in effect now or soon.
The 40% capacity issue was an edict that was issued this morning, officially this morning, and they're letting the grocery stores ramp up on it. But if you've noticed that corporate has already put it in. So if you go to Stop and Shop, especially the Mid-Island Stop and Shop today, I haven't gone downtown to confirm it myself. They have the arrows on the floor pointing one aisle, going aisle each way, and they've shut down the Pleasant Street entrances and are funneling everyone through the Sparks Avenue entrance so that they can keep a head count of everyone who's coming in and coming out, so that they can enforce that. I think it's been working. The elder population times is still active, so they can still go in before everyone else. So they are putting all of this in place, and I think it is functioning. A few stragglers here and there, people who don't see the arrow but still want to go in one way because they can just grab the one thing. That's going to happen. It's part of the growing pains, but it's pretty effective. It's working.
Thank you. Matt, did you have a question or comment?
Just, I wouldn't worry about the constitutional issues and some of those other. If you have reasonable requests for the Stop and Shop, they will reasonably follow them. They are their staff is concerned, and they are, my guys are in there once a day now early, and they are, they're on the same boat as we are. So I think if there's anything that's, that we think is important for the island, if we ask, they'll do it.
Absolutely, they've been excellent. They've been excellent. Don't get me wrong like that. Any of the requests that we have given, they've been excellent at what they're doing. But as far as telling the public that no matter what they have to wear masks or things like that, that's where the issue becomes something, and they have to enforce that as a private entity. But absolutely, they've responded to every one of our requests, so the reasonable requests that they hear from us. They've responded to every one of them, and we've received little to no pushback. When we asked about the barriers, to put barriers up, they had already started thinking about it. There was just a backlog of plexiglass is really what it came down to, because grocery stores across the country, we're starting to order plexiglass for the same reason. So it's a trickle-down effect of some of these shortages. You still can't get a hold of toilet paper in some areas, including here. So there's certain shortages that are still there. It's not necessarily that they're not willing to do things. It's just, as of right now, sometimes they can't, but they are doing a great job at responding to any of the requests.
Jason, sorry.
I was kind of waiting to see anybody else. Rita, if you wanted to go ahead.
Rita have her hand up?
I thought I saw something.
Okay. I was pointing at you.
Okay. I just wanted to give the board my opinion on listening to Gary and where I'm at. I am not. I'm not looking for an all clear. One of my big concerns is in another 2 weeks, in another 3 weeks, when families don't have any money coming in and they're looking at their kids and the rent that's coming in and health insurance, and they're looking at that they can't work, and they're kind of looking outside, and they're going to feel forced with the fear and anxiety of providing for their families, and they're going to go out and they're going to work. And I feel like if we don't not do the all clear, but some little, I think like Gary said, measured reentry that's really, really small, and there's a system in place with protocols and best practices, then I think we can do that. And I'm not worried about the date. I'm not set on April 20th or April 30th or May 4th, whenever EOC and the hospital thinks that makes sense. But I really want to listen to the voices of our community, and that there's some hope that a little bit is going to come back. And I think we need to have more clarification on caretakers and the plumbers, things that Libby already said that we're going to be working on next week. So I'm glad that that's happening. The moorings, the house moves. I've been working with the landscaping community and some of the restaurants, just listening to some of their concerns. And I think there is a way that we can do it. We can control it and not overrun law enforcement and the building department, health department, running around trying to stop people. I think if we don't put something in place for a very, very measured, small reentry at some point, that we're not going to be able to control it. And it's going to be the exact opposite of what we're trying to do. That's my main concern.
Christy, then Matt. Christy, then Matt.
Yeah, I just wanted to expand a little bit on Jason's comments. As part of the chamber, I've been meeting with different industries, and really what we're hearing is every industry wants to comply. They want to do what's safe for the community, what's best for the community, but what they really want is some communication and guidelines, and not necessarily a date like Jason was saying. We don't need to know if it's April 20th, April 30th, but what will a reentry look like, and how can we start putting some protocols together? I think it's really helpful to hear that the town is thinking about landscaping and construction and restaurants, but I also want to urge us to think about every industry on the island. Retail is being hit. If we're going to allow, one person on a construction site, are we going to allow one person in a business to do e-commerce, or, at least be open for curbside delivery of their products? Or we also want to start thinking about events. A lot of nonprofits are starting to cancel their summertime events, and that's going to, trickle down to hotel lodgings being canceled and meals, restaurants not being served. And then that again trickles down to the town meals and revenue income. So just thinking about all of this, again, it doesn't need to be a date, but how could these entities start planning if they're going to have reduced occupancy, or retail is only going to be able to have 2 or 3 people in their store at once? They need to start preparing for that and ordering the items that they need to make themselves successful and make sure that we keep our community safe. So I just wanted to think big picture as we're focusing on some of the smaller, or they're large industries, but focusing on, construction and restaurants right now. Also think about the other parts of our economy.
Matt?
Yeah, I think that the two that jump out to me, and I'll say I've taken part in a couple Zoom conversations, and it is encouraging when you hear some of the people, the concerns, say the landscapers, the concern they share the same concerns we all have, and they also, they want to self-police, but they also want to make sure that we police them, and that there's strict rules and fines, because they don't want to be in a situation where they're all shut down again June 15th, July 7th, some other date. So they really are asking, sort of how do we do this in a measured approach, and how do we make sure that it's, sort of strict and fair. And so that, I was pleased by that. I think Jason hit it right on the head, hit the nail on the head, is saying there's a lot of listening that has to go on now, and we should be widening our scope and having that listening happen now. What are the concerns of the marine people? What are the concerns of the real estate agents? Can we, we probably won't be back to business as usual. What can we be back to that will work? That will, sort of help them survive the best they can and work for the community. And I don't think that we have to sort of widen our reach and really listen and bring a lot of that back. And, and if we do, I think we'll have the support from the public and from all the different aspects. And if we don't, I think Jason's right. I think people will start saying, well, I'm going to listen to the governor, and et cetera. One of my biggest concerns is that the governor is looking at the state as a whole, and, all those towns are right next to each other. We bring in people from all over the world, and we're going to have some people coming in that are, who've been places that are past their peak and have gone through it. There are going to be some that are just starting maybe. And so how do we handle that? We really have to start getting, sort of our protocol in place. So that's all for now.
Jason?
I was waiting to see if Rita was going to raise her hand. Before I forget, I think we need to build relationships with the people who are going to come here. I think there's ways to do it with real estate companies, and whether that's July or August or September, whatever it is, caretakers, and there's campaigns we can do. Just sitting here, like, this should be everywhere. I know it's backwards, but it says 14 days, right? You step on this island, it's a 14-day quarantine, right? And social media campaigns where people are counting down the days where they can, you know what I mean? I think there needs to be that this whole island is like, oh yeah, 14 days. What day are you on? I saw you just got here. I know it's kind of a bit of a silly idea, but those kind of things work. I just want to share that before I forgot it. I think last thing, I think we just need to have a mindset of building partnerships with the boats, with, like what we're starting to do, landscapers, cleaners, like Christy said, not forgetting retail, who else out there, right? The marinas, and start listening and start talking to them. Everybody wants to, of course, open now. We know that's not going to happen, but hearing their voices, and they're the leaders in their industry. They understand it, and taking that and putting it into like Gary said again, the measured reentry. Thank you.
Rita?
I really want to commend my other board members for all the time that they've put into having these listening sessions, and I know working on some possible protocols, as well as town admin as well. I'm wondering, Dawn or Christy, maybe if I think one of the delayed industries that will be hit if we are really discussing, how do we deal with influx of visitors, is the hospitality industry, the real estate, the rentals, the short-term rentals, really. And you may have already started talking to them, but I think that is going to be an industry that is hard hit if we are discussing 14 days quarantine, which I think right now sounds reasonable to a certain extent to at least consider, but what would it actually look like? And then everyone else as well, retail, restaurants. But I do think the short-term stay and how we deal with that is going to have to be a consideration.
Christy? Christy?
I think she's frozen.
Oh, what happened? Christy, can you hear me?
Can you hear me now?
Oh, yeah, there you are.
Okay. Yeah, I was just going to say that I have had some discussions with the the Lodging Association, and a lot of, I'd say across the board with lodging and anybody, it's just the fear of the unknown and wanting to get clarification. They're wanting to know, if they have to have turnovers, like what is going to be the cleaning protocols? Do they need to have, rooms or apartments cleaned on a longer basis? So maybe they shouldn't have same day turnovers, and thinking about things like that. And that's going to need some regulation from the town. I think right now what they're looking at, again, kind of to go back to the events and that protocol, is they're losing so many of their reservations right now. And how can they kind of defer that so people can come maybe in November and December, but with no plans in place for how nonprofits can even apply for event permits? It's hard for the lodging to advocate to reschedule their bookings. So that's something to think about, is just how everything's really interconnected.
Yeah, there's so many planning pieces that come into this in every one of these industries. I've been talking to some of the builders, and of course I've been talking to people in the real estate industry, and everybody that I've talked to really wants to do the right thing, have the planning in place, have, even have like the ability to try and purchase the PPE that they need. So they're looking for some kind of plans, so that they can be ahead of it. It takes a lot of time to put all these things into place, and to do things like move reservations around, and be ahead of kind of slowly reopening things, and figuring out what does Nantucket maybe look like at 50% occupancy this summer, is one of the things that I've kind of been talking to people about, because there's no okay, we're through this, we're back to normal. The disease itself is not completely going away, and we will have a mix of population. I mean, we're actually starting to see some reverse problems right now, where I think some people who live here are going off island to work and then returning back. Because they're not allowed to work here. So, some way to put some very measured things in place to allow some form of income to people that's very safe. I mean, one thing I've definitely have been talking to people about, the caretaking. I think that people should be allowed to go and check houses independently on their own, one person in a vehicle. And it helps protect those assets from potential catastrophic damage. I think that, we also then tend to see more stresses, more domestic violence, and more potential theft as people have no incomes. So we really need to get planning in place. And I've seen drafts today of what the landscapers have been working on with Jeff Carlson, and what Plus has been working on in terms of the building industry, which we'll be able to discuss in more detail next week after there's more review. But I want to give people some peace of mind that there are some things coming that will be very small at first, and that we really are not going to be looking at a full turn the faucet on. It's going to be little drips, but all of us working together and recognizing the issues in each industry and giving them the tools to plan ahead is going to be really important. Christy?
Yeah, I think you really nailed it there, that we really just need the tools to plan ahead. And just to kind of put another suggestion out there is, if there's going to be any change in process, things that typically come to select board, like a change in having restaurant tables outside, or anything like that, or with bed and breakfasts being able to serve breakfast. Like, I think we should start talking about that to get the information out to these businesses and have that be part of our rollout plan. Thanks.
Thank you. Matt?
A quick comment. I think sort of we're talking about the events, and if I were in that situation, I'd be planning not to have an event. I'd be asking for people to fund me without having to expend the money for liquor and tents and everything else that we're doing. This is, there's no way that we can predict, with any certainty when the all clear is going to happen and when you're going to have more than 10 people together. And, and that could go right through the fall into the winter. So, so I just think, I hope that the people who are listening are thinking about that and saying, what other ways can we generate the excitement and the excitement and the fundraising that we need for our nonprofits? How can we do that short of a lot of alcohol and a lot of dancing? I mean, there's other ways to do this. And I think this is a perfect chance for them to start rethinking it.
I have heard of a lot of cancellations that have been happening. I just saw notice that the Dreamcatcher event in June was canceled, and they're asking for people to make donations and planning it for next year instead of trying to push it into the fall or anything like that. I know that Nisha also canceled their summer event, and I think the Artists Association did as well. I'm not sure about others. Are there any other board comments for right now? Should we hear from the public? Try and get some input from them. Andrew, do you want to turn that on and Jason can read out the questions or comments? And again, if we won't get to necessarily all of the comments, but we do put together answers after the fact as needed.
While that's being turned on, quick thing I forgot to mention regarding annual town meeting. The warrants are ready to be mailed. However, before they're mailed, and of course they say April 4th on them, we're going to prepare a letter to all the voters who will be getting a warrant explaining that town meeting right now is rescheduled for May 30th, and we'll explain that keep your warrant. It's still valid. There may be some motions that change, but just hang on to it and stay tight, and we're going to get out what we can on the motions that might be changing. We could give a little idea, like there might be some budget things that change, some capital projects potentially, things like that, but just FYI.
Thank you. I know it is live now. I don't know if anything's starting to come through yet.
Nothing yet, Madam Chair. I just refreshed.
If anybody wants to make any comments or say anything in the meantime, raise your hand. Oh, Jason.
Just one of these, like the weird scenarios that are happening or will start to happen more when people start coming to the island. Where it's not essential service to go turn someone's water on, and I understand why. If we don't do that, and then the person, the homeowners come into the house, and then it's potentially a public safety issue because they have no water. Now we have to go into that house while they're there and turn the water on. This is just one example of how difficult it is to think through all of these different situations. And I don't know what the answer is to control that and to put protocol in place, but I'm hoping there's something we can do with caretakers or gas companies. We have to go turn on water to open up houses, because when people get there, then we're going to have to do it.
I know this is probably going to come up more. This has come up repeatedly in here and with other towns as well, including on the Vineyard. And a number of other towns are saying, we're not turning the water on, so don't come to your house. Because it's going to happen, like you say, Jason, but this whole thing is then worse again.
I understand now, Libby, but people are going to come to their house because they can. And we can still say, please don't come to your house. Please don't come here. We don't have the resources, everything that we have been saying. And people are listening, but it's coming. I don't know when. I don't know if it's June or May or when it is. And that's a potential issue we're going to have to deal with.
It's slowly happening now, and it's not just people who, it may be a lot of people who are coming back from places that they were for shorter periods of the winter, and Nantucket is really their primary home. But if they were gone for 3 months, they shut their water off. So there's not going to be a way to not have people returning to their properties. We can definitely recommend and keep telling them everything that the hospitals told us, but especially as we get into May, there will be a much bigger influx of people, and we need to be prepared for it and not be putting people at risk.
I have one comment question here. With the fall off in revenue, will the Steamship Authority and/or airport have to look into the town to make up any deficits?
Are we meant to be answering these now? I guess as we can.
If you can, then we can get back to them.
I think it's way too early to know if either one of those entities would need that. The airport is obviously an enterprise fund, but ultimately a town operation. The steamship is not a town operation. However, Nantucket and the Vineyard are each responsible for, I believe, 35% of any deficit each.
Question here, this might be for Gary Shaw at the hospital. I didn't understand how the peak on the mainland will affect how we begin to get back to normal. I think that's an important point.
I go listen to the video or the audio clip that's on our website, which talks about how you look around the countryside where you have peak outbreaks occurring, and you've had a rapid climb in caseload, and that's always followed by a percentage of deaths. The rapid climb on the coast has not peaked yet, and therefore the death curve hasn't followed it, which it does under the statistics that are there. When you see that death rate not just start bouncing around at one number, but suddenly really drop off, that's when areas are starting to see a decline in infectivity, according to the epidemiologists. And then you start looking at communities starting to take measures to move back into starting their businesses and starting to think about next steps. We've not seen that in Boston yet, and we've not seen that in New York yet. And so until we see those two things occur, we still are not out of the woods related to migration that comes here. That's really the comparison.
Thank you. The rest are comments. Is there a way to put or to ask Steamship Highline Airport to attach to ticket reservations the 14-day quarantine info? I think it's a good suggestion for outreach when we get to that.
I was just going to say at both lines, I believe in Hyannis there are signs that talk about the 14-day quarantine.
Madam Chair, nothing else at this point.
Okay. Maybe just one question for Gary. Do you think once the availability of the potential antibody test is out there, that people will almost like have a certificate showing that they have already had the virus and been through it and probably have built up some antibodies?
Of course, no one's going to have a certificate, but with our electronic medical record systems now, a lot of folks will doctor in one part of the country, but yet come over here and then doctor for the rest of the summer. And there's interfaces between different companies, electronic medical records, for being able to show data that might have been gained from another population. So I know that if they have a provider relationship here and there's some question as to whether they've been infected, then that information can be shared electronically through permissions that the patients would give us. There's two parts to that toolbox. So there's the tests that we want to have available that are more readily available, almost on demand, which aren't projected to be for months, if then. And that's the screening tools right now that do the initial screening to say that we would have a positive. Right now, there is no test that I'm aware of today, and the video audio clip on our website with Dr. Fossey suggests that that's a couple of weeks away, according to what he and the president have been talking about. So those two parts really need to be in obvious availability before we would be able to use them to make any definition of virus circulating in a population. So we're not quite there yet.
Thank you. Rita, did you have something?
Oh, yeah, I just wanted to clarify, because it came up in someone that I was speaking to, is that the 14 days quarantine is from when you get to Nantucket. There was someone that was thinking of coming to Nantucket. They've been in isolation wherever they are, planning to travel, but that it's from when you get to Nantucket, even if you've been isolating wherever you're coming from. And I believe that's correct, but I just wanted to clarify.
Is the directive that it's when you get to the state of Massachusetts right now from the governor?
Okay.
I mean, I'm looking for someone to.
Yes, that's correct.
So to that point then, oh, sorry, yeah.
No, go, Rita.
If you're coming from Boston, you've been self-isolated there. In theory, then you wouldn't have to quarantine. We're not talking about then quarantining once you get to Nantucket.
No, but I would probably look to Gary for this, but again, now you're coming from somewhere and you're passing through places that
they have to. Our order says they have to quarantine, regardless of where they're coming from.
Okay, sorry. The chief is saying that our local stay-at-home order says you do have to self-quarantine when you get here, no matter where you're coming from.
So it's once you've gotten
expired.
Okay, thank you.
But right.
Right now, we're under the governor's order unless we want to make changes.
Just on that point that Rita just made, my daughter has a friend. He runs large boats, and what they're doing with their staff around the country, who all fly into the Northwest to do it, is they are quarantining at home with very strict rules. They have to travel through the airports with gloves and masks and everything else, and then they can't stop and get food or do anything, and then they're going onto the boats. So that's sort of interesting. The other option was to bring those guys out there and quarantine them for 14 days near where the boats are, but they're more worried they're going to get in more trouble with that scenario than the other. And so people are doing it different ways.
A couple more comments if you want to take some, Madam Chair.
Sure.
This is more of a comment, but it's in the form of a question. How does a person coming down for the weekend do a 14-day quarantine? Another question. If the town cuts occupancy by 50%, are they going to cut commercial taxes by 50%? I don't know if we can answer that, but I'm just trying to give all the comments.
Yeah. I don't think we've gotten to talking about that kind of thing yet. And I think that what we're looking at in terms of occupancy cuts are just what is going to happen as a result of this nationwide in terms of people's willingness to travel, ability to travel, what might come down from the state level. I mean, as of right now, we can't accept any hotels or short-term rentals until at least May 4th. So I don't know if that's completely clear to people. It's been a little bit confusing because we initially had our own stay-at-home order in place, and the governor's stuff has differed a little bit and has been added to. So there's a lot to take in. I went back and read everything last night. Bill, did you have your hand up?
Yeah, I just wanted to say, I think all the discussion about looking forward is great, and we've been doing a lot of that here in the ELC, believe me. But 80% of it's going to be dictated by the state as to what ultimately happens as far as cutting occupancy levels and things like that. Anything the island does is only a decision to either make something more strict than what the state is going to set it at. So, we're not going to be in a position to be able to say, well, the state wants us to go down to 50% occupancy, but we don't like that. We're going to stay at 75. That's not probably going to be the reality. The reality is 80% of this is going to come from the state. I know they're having the discussions because we're on the phone conferences where they're talking about having these discussions. But right now they're trying to get through the peak, and they're not really focusing a lot on guidance on what the other side looks like, but they will. It'll be coming in the next week or so, I think.
Thank you. That's really helpful. Jason, was there anything else coming through?
There's a couple more. Someone said, please explain the 31-day rental threshold. Most people I know do not have any clue about this.
So currently under the governor's order, I think I can answer this, but anyone can correct me, is up until the May 4th deadline, which may be extended, is that a long-term rental is 31 days or more. So in fact, my understanding is someone could come for 31 days or longer and check into a rental. Then they would be advised to self-quarantine for 14 days if they traveled from out of state. But anything shorter than that is currently not allowed for hotels or short-term rentals. Did I get that right, EOC?
Madam Chair, one more. New York governor said today in press conference that New York, New Jersey, and Connecticut are working together on plans to slowly return to normal. Do we know if Massachusetts is a part of these conversations?
Does anybody know?
We're not, we don't really know what the state is, but that's probably because of the tri-state transportation system and things like that. But maybe, I don't know.
Are we good?
Yeah, I mean, there's a couple more coming in, but we can keep going, or we can
maybe two more, and then we can get back to people if any more come in.
A lot of them aren't really
not questions
answerable, but if the state opens up by the end of May, what is the town's plan for Memorial Day weekend? Do we think we're going to see the same crowds come?
I mean, I would say what I said before, most likely, is that that's just going to be dictated by nationally people's willingness to travel. Fagawi has canceled themselves, and no big weddings or events like that are currently allowed. Most people are changing all kinds of events like that into fall dates. So there will probably be an influx of people, but I don't think it will be anywhere near what it normally is.
So maybe do one more. So even with all the orders from the Select Board and Board of Health, people are going to be able to day trip or possibly even stay in a hotel while protections are being placed in this event.
Right now, they cannot come and stay in a hotel. And most likely there will be additional directives coming down from the governor that, as the chief mentioned, will probably be coming down in the next week or so to give people time to prep for what's coming after May 4th. Is that fair? Answer?
Yeah, except essential services can come and stay at a hotel.
Yes.
But other than, yeah.
I think that's fine, Madam Chair. All the other questions, we can get back to them.
Okay, great. So, well, we can turn public comment back on just to see if actually after the census update. Does somebody else want to talk about the census?
Well, the census is very important, and Nantucket has had a low rate of response so far, so we're really, really encouraging people to get to it. It's very simple to fill it out online. There's something in the packet on this?
Yes, there's a notice in the packet that they asked to be read.
I'm trying to get to it. I'm going to learn about those bookmarks. God, there's a lot of COVID stuff in here. Okay, census. This whole thing?
Do you want me to read it?
Yeah, sure.
Yeah, the whole thing.
All right, United States Census 2020. Nantucket Census Complete Count Committee recognizes that our community's health and safety are the most pressing concerns during this unprecedented time, and that communication about public health takes priority. However, the 2020 census is ongoing and vitally important for Nantucket's future. It's never been easier to get counted and to count everyone who lives at your address. You can use your smartphone, tablet, or computer to do so online. You can do so over the phone in 13 languages. Or you can complete and return the census questionnaire that may have been delivered to your home by now. You do not need a form to respond online or by phone, however. The U.S. Census takes place once every 10 years and is mandated by the Constitution. Statistics from responders are used to make decisions about federal funding for community services that we rely on every day. Healthcare, including Medicaid, Medicare, and the Children's Health Insurance programs. Schools, food assistance, housing, emergency services, senior programs, and more. An accurate count ensures that Nantucket gets its share, as funding levels that are determined as a result of the 2020 census will be in place for our community for the next 10 years. Please get counted and encourage friends, colleagues, and family members to do so at 2020census.gov. Choose your language and click on the respond button to take the census. It's safe, quick, easy, and individual data is protected by federal law. Your information cannot be shared with any federal, state, or local agency for any reason. There is no citizenship question on the census, and everyone is asked to participate. We all count for Nantucket. In an effort to get out the count on Nantucket, we've started posting information on Facebook via the Community Foundation for Nantucket's page. Please visit the foundation's page so you can see and, very importantly, share these posts on your own personal and organizational pages. You'll recognize some faces and can learn a lot about why an accurate count is important. If Facebook isn't your thing, please share the information on Instagram or Twitter, or even by email. Please get counted and help shape Nantucket. To put a little perspective, if we were actually counted now at what the data platform has projected as our actual population numbers, I think we'd be looking at a couple $1 million more in funding per year, was the estimates that I've heard.
Yeah, that's correct.
Okay, let me go back to the agenda.
Before you leave census, Don?
Yep.
Just a thought I had just now, because we were talking about Stop and Shop. A lot of the people, I think, are not, going to those web pages and doing the things you're talking about. Can we have a handout and just put it in on the bags for a couple weeks? Is there something like that that could be printed and done quickly now? And that's, I guess, for the Census Committee, but that would catch everybody.
Mm-hmm. We can pass that on to them, sure.
Okay, next we do have a public comment portion of our agenda. If we want to turn that on just to see if there are any public comments that are not related to COVID-19. Okay, it just got turned on. So we can just give that a moment. Maybe we just want to jump to new business while we're seeing if any comments come through. And Brian Turbett would probably talk about.
Wake up, Brian.
I'm awake.
Just unmute.
Okay, so thank you very much, Madam Chair. So I think that you may have gotten the AIS, which talks about on Friday, April 3rd, the governor signed Chapter 53 of the Acts of 2020, which was an act to address challenges faced by municipalities and state authorities resulting from COVID-19. And the three portions that are kind of key for the town, among other things, are require some local action by the Select Board. Section 10A, subsections 1 through 3, by a vote of the board would allow us to extend the due date of property tax bills from the May 1st date to June 1st, which in the AIS, we are recommending that the board take that action by voting to adopt that section. The second option that was included in the legislation was an option to extend the due date for exemption and deferral applications. These have a due date of April 1st. They're delivered to the assessors. They include the residential exemptions and any other deferrals that are allowed under Chapter 59, Section 59. So with a vote to adopt Section 10A, subsection 4, then we would be able to extend that date to a date not later than June 1st. And I've talked to the assessor, and she recommends the June 1st date. She said that won't present any significant challenges if the board were to vote for that, to adopt that section and make the date June 1st. The third piece that's, I think, really critical and has been discussed about with respect to excise taxes before is Section 11, which would require a vote of the board. And this vote in an affirmative adoption would allow the town to waive interest and penalties or other any late payments of any excise tax, real estate tax, betterment assessments, or apportionment thereof. The water company can also do it. And I'll be talking to Mark Willett to see about his board adopting that section for any late payments or interest or penalties for water bills as well. It's important to note that this isn't a blanket waiver for all interest. It's only allows the waiver of interest and penalties regarding late payments of bills with a due date of March 10th or later. Okay. But it also has a provision in it that requires that in order to qualify for the waiver of interest and penalties, the bill has to be paid by June 30th of 2020, or else the town's ability to waive the interest for those payments would lapse. So we are recommending that the town vote to adopt all three sections of the act that allows us to make these changes to hopefully provide a little bit of help to the taxpayers and the residents who have been asking about what we can do.
Christy?
I just have a question, sort of related to this, but not quite. I've seen that other towns are waiving the credit card charges when you're paying these bills online. Is that something that the town could do on itself or needs to be passed through by the governor?
We could certainly look into it. We'd also have to look at the available funding for the budget at the time, because obviously we'd have to have a budgetary line item that we could charge it to, but I could look into it and work on it tomorrow to see if that's possible as well.
Okay, thank you.
Is there any other, Matt?
Yeah, without these, what discretion does the assessor have to not charge fees, et cetera?
Without these, it's actually the collector. There would be no statutory authority. The maximum that the collector, without adopting Section 11, without adopting that, the maximum that the collector can waive in interest and fees is $15 in total.
Okay. Well, that kind of answers my question. I don't think it goes far enough. I think 30 days and making them pay by the end of June, when people are trying to decide how to feed their kids or whether to pay their mortgage or for their car. I think that this doesn't go far enough, but I think we have to support it based on what you've just said.
Is there a motion?
So moved.
Is there a second?
Second.
Okay, I'll do a roll call vote. Jason Bridges.
Aye.
Christy Ferrantella.
Aye.
Matt Fee.
Aye.
Rita Higgins.
Aye.
Don Holgate, aye. Thank you.
Thank you, Madam Chair.
Thank you. Next, we have minutes from October 2nd. Can we do the minutes, payroll warrants, and treasury warrants all as one motion?
So moved.
Second.
All those in favor by roll call on items 1, 2, and 3. Jason Bridges.
Aye.
Christy Ferrantella.
Aye.
Matt Fee.
Aye.
Rita Higgins.
Aye.
Don Holgate, aye. Those 3 are approved. Nothing new under town manager's report. I think we were covered that up top. And we have under select board's reports, a review of a draft comment letter to Mass Environmental Policy Act office regarding Surfside Crossings environmental notification form. Tucker Holland is going to present that to us this evening and answer any questions.
Sure. Thank you, Madam Chair and the board. As you all are familiar, Surfside Crossing has recently submitted its environmental notification form to MEPA. There is a comment period. We are in position to be providing a comment letter. The comment period originally was until April 14th. MEPA, under the current emergency order situation, has extended that until April 28th. Nevertheless, we would like to finalize this letter. We would also like to get your authorization to participate in a video conference on this topic, which MEPA will be holding next week. You all have been provided a copy of the letter prepared by town council, being John Whitten and George Pucci. I'm happy to address any aspect you'd like. We're looking for your comments on this letter. I did have the opportunity to individually speak to the board members, as you know, and we think that this letter is reflective of the board's collective views on this, although the board has not had a chance to discuss as a body. There are a few edits we know we would like to make. The town manager has provided some good comments, nothing that materially changes the direction of the letter. We did get some input from Emily Molden of the Nantucket Land Council with respect to just sort of technical timing around the CMP and the footnote, and that technically has not been issued. And so Attorney Whitten is planning to make that change as well. So we're hoping, again, to get your input tonight and the authority to make further changes that we would think appropriate and submit this letter in a timely manner to MEPA.
Does anybody have any questions? So I think what they're looking for is we would authorize Tucker and town council to finalize the letter with a few edits, and also to participate in a remote call next week with MEPA.
That's correct.
Rita?
Is that remote call as a full board?
No, I think it would be Tucker and council participating.
Okay. No, I thought the letter was very thorough and hit key points. I don't have anything to add or edit, but I do think it was, it's long, but it gets all the main points. So thank you for putting that together.
Christy?
Yeah, I just wanted to clarify. I know Tucker and I had talked about this in last week's comments. I know Emily Molden had asked us to bring it back to the local ZBA, and that is not really a request that would go through MEPA. So just wanted to clarify that we weren't ignoring Emily's comment, but that we were taking the proper channels to respond to this in the way that we should.
Thank you for mentioning that.
We'll be taking that matter up next week in executive session with ZBA participation. Is there a motion?
Yeah, I think it's a great letter. I think that we should we should try to get a new environmental report, and we should have access to the property to do that. That's one of the key points in there. I think they did that well. And I think it's a new submission. They missed the date, and it's a new submission. And, that should be, I know that it might not happen at this step, but I think the public listening to us has to realize that that's, sort of what one of the stances we're taking. And I'm just really disappointed that it came in now, and it is what it is. But, so I support the letter. I'll make a motion to approve it.
Is there a second?
Second.
Rita? Okay, so by roll call vote. Sorry. Did someone say something? Okay, by roll call vote, Jason Bridges,
Aye.
Christy Ferrantella,
Aye.
Matt Fee.
Aye.
You're laughing about something in the background.
I've got a dog under the bed here and my wife yelling. That's what you heard.
Rita Higgins,
Aye.
Don Holgate, aye. So Tucker will finalize that.
Thank you all.
And did any public comments ever come in or no?
Yeah, there was one that wasn't related to COVID-19. Are you going to discuss the CONCOM letter to the select board about SPPF violations?
We are going to be discussing that matter in executive session next week so that we fully understand what's happening.
I'm sure at some point we'll be discussing it on a Wednesday night.
Yes.
Yep.
Go ahead.
That was it for a public comment. That's non-related.
Okay, well then we have committee reports. I don't know if anybody has anything besides what we've already talked about, but now's your chance. Okay, so we're going to clap for all of our medical professionals and first responders and town employees and Stop and Shop workers and everybody who's on the front lines of all of this. And there are many more people on that list. But so can we just take the opportunity to all put our hands together? I would say take your mics off. I mean, take your mute off.
Put your hands up.
Thank you, everyone. We really appreciate it. And we will reconvene next week. We are working on plans. We do know how tough this is on everybody. And that's all there is to say right now. There will be some additional videos coming out on Friday as well. Is there a motion to adjourn?
So moved.
Second.
All those in favor by roll call. Jason Bridges.
Aye.
Christy Ferrantella.
Aye.
Matt Fee.
Aye.
Rita Higgins.
Aye.
Don Holgate, aye. All right, thanks everyone.
Thanks for being on, Taylor, Gary. Thank you.
Good night. Thank you for the opportunity.
Thank you.